Hello, welcome to the Sandton Fertility Clinic. Our clinic is housed in the Center of Advanced Medicine. As you can see behind me, these are the two buildings that constitute the campus of the Center of Advanced Medicine. And our clinic is housed in the South Campus. The Center of Advanced Medicine is synonymous with medical excellence because of its highly skilled doctors and staff who expertly utilize cutting-edge medical technology to deliver effective and safe healthcare compassionately. The doctors at the Center of Advanced Medicine are leaders in their respective specialties. This is the ophthalmology department at the center. It is one of the specialties represented here. In addition to fertility, gynecology, the center offers state-of-the-art services in endocrinology, radiology, psychiatry, maxillofacial surgery, cytology, and more. This is my office in the Sandton Fertility Centre, and this is where the initial consultation of the patients take place. We like to see the patients as a couple because we believe that infertility is the problem of the couple. So this is where we take a good history, and this is where we do counseling for the patients. After the consultation, the patient is examined in the examination room. Along with our experience and expertise, we can offer understanding and support as you face your personal challenges of infertility.
These are the laboratories where we use state-of-the-art equipment to perform world-class reproductive techniques.
Services start from your initial evaluation to offering the most advanced form of treatment available, namely artificial insemination, in vitro fertilization, intracytoplasmic sperm injection, also known as ICSI, a process that we'll show you a bit of now. Fertilization through ICSI is achieved by injecting an individual sperm cell into each of the collected eggs by means of a very fine needle. Following injection and after 24 hours in an incubator, most eggs will show signs of fertilization and the cells divide and multiply to form an embryo. After a few days, a healthy embryo will comprise of 8 cells. It is then transferred to the uterus where it is left to implant and form a pregnancy. Our clinic provides a friendly and caring environment because we understand that fertility treatment can be an emotionally difficult process to go through. We would like to make the path to having a healthy baby as easy as possible for you. Our lab has all the modern facilities allowing for procedures such as IVF, assisted hatching, cryopreservation, and egg retrieval. A needle is attached to the vaginal ultrasound probe. Both are introduced into the vagina. Under ultrasound guidance, the needle is inserted through the vaginal wall towards the ovary and introduced into one of the follicles. The content of the follicle is aspirated and is passed through a closed circuit of tubes to the test tube. This test tube is analyzed by a biologist to separate the ovum from the follicular fluid. Once aspiration of the follicle is finished, the needle is inserted into the next follicle, which is then aspirated. The process is repeated until all the follicles have been emptied. Our facilities also allow for the treatment of couples who face the challenge of blood-borne virus diseases such as HIV and hepatitis. The final step in IVF is the embryo transfer. The success of the IVF process depends on the delicate placement of the embryos at the proper location near the middle of the endometrial cavity, with minimal trauma and manipulation. So this is our staff complement at Sandton Fertility Centre. Each of them are well qualified in their individual fields. We're here to welcome you. They are all passionate about the management of fertility, and we will eagerly walk each step of the way with you on your journey to achieving your goal of starting a family.